Welcome to a partnership conference. The theme is interoperability, and Dr. Harris has talked about his experiences with interoperability at the Cleveland Clinic. And I know that I'm preaching to the converted because all of you, whatever your function, you've come to this conference because you want to hear more about interoperability and you're kind of active in that field. And certainly that's a key concern of myself and the team at Infoway. And what I wanted to talk about this morning is basically focus on the patient and why that's important for Infoway. And to give you a flavor really of some of our thought process around our strategy, because I'm sure that I get a lot of questions about what are we doing next. And so I'd like to spend a little bit of time talking about that, the process that we've used to lead up to that, but also cover some of the things that are happening within the Canadian field, whether it's at the political, the technological, or the societal levels that have kind of been components that we've really put into our thought process as we've looked at this strategic exercise. What I wanted to talk about, why the importance to focus on the patient. And I know that, I'm not naive enough to know that all of you are focusing on the patient every day. And I think there is, superb patient focus. And it's an obvious thing to do, of course. We're in the healthcare field and that's what we should do. But I think that the basics of that is really to come back, to, look at areas that we can contribute that will really help make a difference to the patient and the patient experience. And nowadays, it's very, often that you hear organizations and people talking about being patient-centric and patient-focused. But what does that mean, and what do you need to do to be patient-focused? And from an Infoway perspective, what do we need to do that? And I think that, certainly during this exercise, we're going to look at the organization, how we communicate, how we build our internal strategy, and so on, and feel how can we have patients contribute more towards that. At the moment, we don't have a patient activist on the board, and many hospitals I know and institutes do have patient activists on the board. You could also say sometimes the board are the furthest from the patient interface, so maybe you need to do more at the kind of bleeding edge than that. I think that certainly seeing what Dr. Harris is talking about in terms of the Cleveland Clinic care process, one of the things you can observe from what he says, they clearly look at every single step the patient has when they interact with the health system in terms of, improving their care, even before they come in to look at their condition, even looking at home conditions to see how the patient's going to recover when they get home. And I think when you look at companies that are customer-focused, you can certainly look at kind of companies like your BMW and Ritz-Carlton's and so on, who look at the kind of high-end type patient or customer experience, sorry. And then you can also look at mass market companies like Walmart and so on that more focus on the mass market. But the key thing that many of these successful companies have together is that they recognize that to really, to get their customers to come back, to get repeat business, they've got to improve the customer experience and do it in a replicable way. And satisfying, delighting customers is the way that they're going to succeed. Otherwise, those customers won't come back. But also, having systems that are great and that do provide great customer service usually are also the most efficient systems. And so they're not only going to affect your top line if you're a business, but they impact your bottom line. And using IT as an enabler to do that is something that every successful business does. And we know that within healthcare, we're still behind in getting to that stage. And so it's identifying the areas where we can really improve patient care and focusing on the health in IT enablers that will help us do that. And that's what we really want to try and focus at in Infoway to see how we can really direct our resources in the most effective way to improve the patient experience. Over the last 12 years or so, Infoway were really focused was on capturing the data electronically at the point of service, establishing like registries and repositories, We've spent a lot of time working hard with the clinicians and other partners to get these systems in use. And so a lot of progress has been made in these areas, and now it's really bringing that progress forward. Last week, which I'm sure you all know, was Digital Health Week in Canada, which was kind of the second time we've run Digital Health Week, and that has been a program that has gathered in impetus and broader support. And in fact, myself, in order to celebrate Digital Health Week, I decided to have a colonoscopy. I don't think it's something I'm going to do every year when Digital Health Week comes around, but the reason I brought it up is that when I was kind of being checked in and my nurse was looking at me, getting me ready to go into the procedure room, she asked me, she said, what do you do? Who do you work for? And I foolishly said, I'm CEO of Canada Health Infoway. And she immediately said, oh, I'm a pen and paper person myself. And kind of looked at me a little bit disparagingly. And I said, well, why is that? And, she was really complaining about the system they had. It was a lot of work to keep it up and running. And then also she said, if someone has a cardiac arrest and the computer's down, what do you do? And I said, well, I hope that's not an indication of how this is going to work out. But, clearly that's an example where, obviously everybody goes through the change process, and the value that worker was getting from their own IT system, and whether it was the system itself or the way that the system had been deployed, was clearly was not a value that they felt was kind of adding to their job. In the end, the procedure went well, and so everything worked out there. But clearly, every user of the system needs to have their own benefits, as well as the end user, the customer or the patient. I'm going to be talking about our plans and also how interoperability fits in that, but also I make a few comments about the kind of changes that we have been seeing. As we all know, we've just been through an election, and there's technological changes as well. Change is a process that, some people say they like change, but usually, if you're used to having tea with sugar in it and someone suddenly removes the sugar, you're probably going to be pissed off about it. I don't think you'll like it immediately. But if you keep drinking that tea over and over again, it's going to be good for you in the end, and you'll probably grow to like it. And often with change, which is extremely good, it can be met with a lot of skepticism. But I think really the lesson is you've got to plow on, and really if you're convinced that this system is going to add value, then you really have to put some effort in to get it out. And that's something that we commonly see when we're implementing systems, but it also kind of focuses our thoughts really, is that our role as Infoway is simply not a technology role. It's much broader than that. It's really helping you and working with you to implement that technology in an effective way. So the couple of areas I want to talk about, first of all, start off from a political area. Sorry, move from that one. And so we all know we've recently had an election, and now we have a new Prime Minister, Justin Trudeau, young and dynamic guy, and we've got high expectations there. Incidentally, it was a Liberal government that founded the Infoway organisation, so it was the Martin government that did that back in 2001, I think. And we've seen really from some of the statements that have been released by the Liberal government that they do have a focus on innovation in healthcare. They've been talking about the health accord. There's indications that they want to have open discussions with the provinces. And I think there's a lot of enthusiasm from everybody, care providers, the provinces, and all, that there's going to be some good positive change and perhaps some additional resources put into healthcare with this new government. And we're in the process, of course, of preparing our budget submission, and we're having discussions with Health Canada as we kind of refine that to make sure that we have the best possible business case at the right time, communicated in the right way, that we can put in front of the government and, more importantly, the new health minister. And we're also very encouraged with the appointment of new health minister, Dr. Jane Philpott. She's a family physician, comes from Markham Stouffville in Ontario, and she certainly is well aware of the issues that face doctors when using EMRs, and she actually made a quote that was published in an eHealth Ontario document in 2014, and the quote was, "My EMR allows me as a physician to record any information a patient brings to me, as well as any other information we collect about that patient into one electronic record. Patients know they can feel confident their healthcare is understood by all of the people involved in their care." And I think it's a fantastic thing to have a federal health minister who is a doctor, but also has a first-hand experience of using an EMR. The Prime Minister recently published a mandate paper, and he sent the mandate letters to all of his ministers, really with his expectations of what he wanted them to deliver. And I'll read an extract from the letter to Minister Philpott, and he specifically asked her, or directed her, to advance pan-Canadian collaboration on health innovation to encourage the adoption of new digital health technology to improve access, increase efficiency, and improve outcomes for patients. So this is extremely positive language for all of us involved in healthcare, and we really do have high expectations that this is going to be very positive for the industry at large. Now, moving on from the political change, we're also all aware of the social and demographic changes that are happening in Canada today. We have an aging population. 16.1%, over 16% of Canadians are now 65 and over. And also besides that group, which is growing, there's a faster growth rate for those who are 65 and older also. The implications of this trend are obvious in terms of chronic disease management and so on, and also the scarce resources and the need really to find more effective methods of care. And also, as a society, many of these people are now the baby boomers who have very high expectations of their care. And that expectation, combined with the over or increased demand, creates a lot of issues for the health system to manage, and also presents further opportunities for technology to help in this process. From a technology point of view, we're seeing proliferation of mobile devices. Dr. Harris also talked about their application of patient-connected systems. And I think really we all know that within the next few years, the next frontier of healthcare IT is going to be consumer-based or patient-based IT that will help connect patients with their caregivers. And for example, McKinsey and Company had done a survey, and they'd identified that there are now more than 1,200 consumer digital health-focused startups, and more than 15 billion in investment was made in this area in 2010. So it is a trend that is here to stay, and definitely one that is very much a growing trend. I think I always like the kind of Uber type example, but it's becoming a little bit hackneyed in some sense. But it was interesting to see yesterday on the news that Uber are getting directly into the healthcare field. Apparently now they have a scheduling version of their application that they're deploying with one of the IDNs in Southeast US. And this system allows them to kind of link in, schedule a patient for surgery, and at the same time, obviously, book their transport, because that's going to be the thing that's kind of connected with that to move with it. And I think, again, Uber's a good example of a kind of disruptive technology, and another example where new change is not always embraced by everybody. There are the regulators, the current taxi drivers and so on that obviously feel a threat by that solution. But in the end, it's much more than an app. If it was just an app, I think it would be a 5-minute wonder. I think the magic of that type of approach is the whole business model that they're putting together. The fact that you can hail a cab from your home, you can see where they are, you can put in the destination before you even get in it. When you get in the cab, you can track your whole journey, and then when you finish the journey, you just get out and leave. You don't have to hunt through your pockets for your wallet, hope that they've got a credit card machine, and so on. So they really have looked at all the kind of pain points that customers have to experience when they go through the process of booking a cab, and they've tried to address all of those. And I think that's the kind of lesson, I guess, that from our point of view in terms of how can we look at all those pain points that the patients experience and use technology and solutions to address those. And also what can we do to stimulate that innovation. So, what are the implications for Infoway? I've now been with the organization for a year and a quarter. As you know, we had largely completed our kind of rollout of the EHR, although from a patient or public perception, I think it's like the iceberg. You know, just a quarter of it is above the water, the rest is below water, but it's a resource. So like an iceberg has ice that could turn into drinking water, I think the EHR, as we all know, is a fundamental resource that is now in place. And we believe that the role we have now is to help you, whether you're a provider, whether you're working in the ministry, whether you're in the private sector, whether you're a patient, is to help you really use the benefit of all that technology, information, interconnectability to really come out with new and exciting solutions and applications that really are visible to consumers, that are visible to patients, and make a visible contribution to their health care. And so how will we do that? And you know, I think one of the things that we have to have if we're looking at that is what kind of criteria we're going to use. And it seems that, you know, I'm sure many of you, or most of you are familiar with the so-called triple aim. And I think that's something that we believe offers, you know, three kind of principles that we can follow in our strategy going forward. And these are the type of things that we want to have as a backbone to our activities. So really we're looking at what can we do to improve the patient experience of care? What can we do that will, at the same time, improve the overall health of the population, and whilst we're doing that, we'll make a positive contribution to improving the per capita cost of healthcare. So better care, better quality care at a more affordable cost. And we're trying, where possible, to put those dimensions on the kind of activities that we want to focus on going forward. And that's driven us really to look at a few guiding principles. For our strategic exercise, we brought in some external partners. We brought in McKinsey. We were also working with PwC on some specific feasibility studies that we had already identified. One was around e-prescribing, another one was around the hospital information system field. But the McKinsey were really helping us with our overall corporate plan. And as part of that corporate plan, of course, we also consulted with you. We did focus consultations that were conducted largely by the consulting companies, and we participated in some of those. We'd already done an exercise a few years ago, a very broad exercise which came up with our current focus in terms of patient-focused areas. But this was really building on that and asking specific questions. And, you know, basically, you know, we know there's been progress, and where we want to focus that now is on how we can build further out in established solutions like with the EMRs, build further on the drug information systems, and those fundamental building blocks going forward. Those of which are largely in place, as I mentioned earlier, but how can we work on those and accelerate interoperability to going to the next level where systems are connected and interacting seamlessly, and providing more accessible, timely services for both patients and clinicians. And so that's been one of the lenses that we've used to kind of look at that. We also worked with McKinsey on an economic model that they had invested a lot of time and effort into. And my team at Infoway worked closely with the McKinsey team. It's an evidence-based model. We use that to evaluate over 40 different technologies. And the criteria we were looking at really was technologies that provide a maximum benefit, but also are affordable to implement. And out of that, we came up with a top 10 list of opportunities, including areas like e-referral, e-booking, remote patient care or home care solutions, and areas like that. E-prescribing was another solution where we've been able to kind of quantify the benefits for the provinces in this process. So I know I'm running a little bit short on time, so I'll try and hurry a little bit. So we are now putting together really some specific programs around patient-connected solutions, and also looking at some broader strategies in areas like e-prescribing. And one of the reasons we chose e-prescribing as an interesting area to look at is not just, we see e-prescribing as a means to an end, but it's also in, drug safety, all of the other issues surrounding medication and drugs, including safety, cost, compliance, and so on, are all very important. And so there's a whole family of possible solutions that can come from here, but also a whole family of value adds that we can look at. Drugs of abuse, for example, and better control of opiate prescriptions is just one of those as an example, as a kind of regulatory issue there. Then moving on to the further one is that basically we wanted to expand our national leadership in areas, because talking about change and governance, privacy, security, areas like interoperability. So we certainly want to use our position and our contacts that we have across the nation and bringing groups like yourselves together to really focus on the key issues that will help enable the rollout of technology. And the final area is basically trying to establish what we call a kind of ecosystem that will help facilitate and enable innovation. And again, a lot of people talk about the I word, the innovation word, and it becomes a little bit tarnished in some ways. But I think what we've recognized is that we really have to do something very active to help try and stimulate innovation. We have the ability, being a federally funded organization, to look at areas perhaps where the provinces are finding difficulty in scaling up specific solutions, where there may have been market failure. And this could be, for example, with 13 different health systems, if you're looking at a specific application, as you all know, trying to meet the standards of each single one, every jurisdiction is going to come up against similar issues. It's going to cost them money, time, and expertise, and the vendors' time and expertise to do this. But we could save a lot by trying to come up with better solutions that we can replicate. There are, in many areas, kind of innovation accelerators and startup groups. We're not going to try and copy what those organizations are doing, but what we'd like to do is work with the provinces, work with industry, and work with those startup organizations to help them scale their solutions and to provide the extra link that they may need to work with you as providers, and also taking a kind of pan-Canadian view so that, again, we can bring a pan-Canadian focus to those areas to really help actively stimulate innovation in that process. And of course, in all of this, we are hoping to attract funding from the federal government so we can support the innovation with financial resources to be able to put these programs in place. So I think I've come up to my time here, and basically, if I can press that hard enough to make it go forward, Going on from now, as I mentioned, we're at the tail end of our strategy exercise. Now we're coming up to the implementation phase. We're putting in our recapitalisation requests to the federal government. We're getting board approval, and really, from January next year, we'll be working on implementing our new strategy, and we'll be communicating with you a lot more about what you can do, how you can help, get your input as well, and watch this space, because we really intend to do some exciting, new, cool stuff. Thank you.